Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the VA Maryland Healthcare System, Perry Point VA Medical Center. My name is True Luster Pauling. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation will be made available after this webinar. This is a live recording. I would like to thank Ms. Nikole Jones for this collaboration. We are grateful for your time today. But before we get started, I would like to pass on Mr. Washington's apologies for not being on the call today. Mr. Conrad Washington is the director for the VA Center for Faith-Based and Neighborhood Partnerships. At this time, I would like to introduce Ms. Nikole Jones, who will be providing today's presentation. Please read a summary of her bio on the screen. Ms. Jones received a bachelor's degree in social work from Howard University. She has worked in substance abuse rehabilitation program and as the inpatient social worker. She provides counseling, education, and community support with the goal to reduce the incidence of suicide and increase access to care. Ms. Jones has been with the VA for 23 years and 15 years in the suicide prevention program. At this time, I give you Ms. Nikole Jones for today's presentation. Nikole?
Good afternoon, and thank you for having me, and I'm honored to present this to you. Our VA S.A.V.E training has really been instrumental in helping veterans and family members know what to look for when a loved one is at risk, but also what they can do in regards to resources available. So I'm going to go ahead and move through the slides to get started. Okay. So we're going to start with talking about some facts about suicide. Suicide is a national public health problem. It's a national issue with raising rates of suicide in the general population. And for every death by suicide, there's approximately 135 individuals that are impacted. So when someone loses a family member or when someone is lost to suicide, there are 135 people that may then become at risk based on that loss. So we're going to talk a little bit. Oh, I went too fast. We're going to talk a little bit about some of those reasons and then also what we can do. Suicide is often a complex interaction of risk factors at the individual, community, and societal levels. And so there isn't one single cause. But what we know is there are several risk factors that we can see at those levels that we can be aware of. Risk factors are the characteristics that are associated with a likelihood of suicidal behaviors. There we go. Associated with suicidal behaviors, and protective factors are the things that can help offset the risk factors. So we want to make sure that we put protective factors on and get them involved in the case because it does reduce that risk for suicide. To prevent veteran suicide, we must maximize those protective factors while minimizing the risk factors at all levels throughout the communities and nationwide so we can make a difference. All right. So talking about some of those risk factors and warning signs. So let's start on the side where the risk factors are. Prior suicide attempts. We know that a big majority of people who die by suicide have had previous attempts. And so it's important that we ask that question when working with someone, especially those that have mental health issues. We want to ask, have you ever attempted suicide? And we ask in a way that makes them not feel uncomfortable about it or shameful about it, but to let them know that this is just like if they had a history of diabetes. We want to know that as part of their treatment. History of mental health issues or substance abuse. We know that if someone is struggling with mental health issues or substance abuse, it makes suicide more likely. And so we want to know that history. Access to lethal means. And we talk about that a lot with our veteran population because, number one, they're really gun experts. They've been trained in weaponry and understand how to use handguns, long guns, and sword. I tell this story a lot when I do this training, and people chuckle a little bit, but I've never had a gun in my hand. So if I were to hold a handgun, I would probably faint. And, we say that and I get a little bit of a chuckle, but the reality is our veterans are very skilled and it's normal for them to handle a handgun. But what we know is that that actually increases the risk. Having access to lethal means does increase the risk for suicide. So it's important that we ask the question when we're talking with and working with our veterans about access to lethal means and talking about how they store the weapon and so forth. We'll talk more about that. Recent loss. A recent loss could be a risk factor for suicide. Legal or financial challenges, relationship issues, unemployment or underemployment, and homelessness. So we know that these are the factors that increase the risk for suicide. On the opposite side, there are protective factors. These are the things that if we can add to that person's life, some of these protective factors, it really does reduce the risk for suicide. Access to mental health care. One of the things that the VA has prioritized is being able to get get access to care for our at-risk veterans. And so that actually can reduce the risk for suicide because they're able to reach out for support. A sense of connectedness. And for our veterans, that's a big piece because they may have been in a unit, had lots of support when they were active duty, but now they've disconnected from the military and they feel a bit alone and they've lost their sense of connectedness that the military provided. And so it's important that they have a support network, problem-solving skills, sense of spirituality. Giving someone having a purpose or feeling a spiritual connection does reduce the risk for suicide. Having a mission or a purpose in life. Their physical health. If they're in good physical health, that's a plus, and it adds protective factors to the case. Employment, and then social and emotional well-being. So someone who has, a solid foundation, they had a good childhood, those kind of things are protective. But if they have social networks and maybe they're engaged in mental health treatment, that social and emotional well-being can be very helpful in keeping them safe. Because the ultimate goal is to reduce the risk factors and boost the protective factors. All right, so we're going to talk about some key findings from our 2021 National Veterans Suicide Prevention Annual Report, which really summarizes some of the work that we've been doing and what we found when we, zoomed in on our veterans and our veterans' risk for suicide and some of the numbers and data associated to those that may have died or attempted suicide. So when you look at the percentage of suicide deaths and methods involved, this is from 2019, you see that for non-veteran U.S. adults, firearms are the most selected method, right? But when we talk about our veterans, that actually goes up to 69%. Same for non-veteran women. You look at that rate for firearms at 31%. And then when you look at our veteran women, it jumps up to 49%. And so what we know is that for our veterans, firearms are, number one, a preferred method, but also they are the most lethal method. And so we really want to ask those questions. And then when you look at them together, male and female population, it accounted for 70% of 70% of male veteran suicides and almost 50% of the females that died in that year. And so we really have to start asking the question about, not to our veterans about can they possess a firearm. Yes, they can. By law, that's their right. And we don't make judgments about that. But what we do say is important for them to be able to take their own temperature with regards to their mental health risk and be able to secure it for the sake of others in their home, but also when there is risk, there's someone else that can help them to make better decisions with where they store it and how much access they do have. All right. So when we're talking about lethal means safety, this is kind of what I had started talking about. But in the context of suicide prevention, we want those handguns to be safely stored. And safe storage of lethal means is any action that builds time and space between a suicidal impulse and their ability to harm oneself. And that could mean that family members can opt to have a lockbox that they can store the weapon in. They may choose to store the ammunition separately. They may decide to actually remove the weapon from the home altogether, temporarily, while there is risk. Effective lethal means safety education and counseling is collaborative and veteran-centered. So we don't say, hey, Mr. Smith, you have to secure your firearms or you have to have someone pick it up. No, we want to say, hey, Mr. Smith, what can we do to put time and space between that thought for suicide and your access to your weapons? What recommendations do you have, or what might work for you? It's going to be very collaborative, and it's the veteran's decision. We just want to give them options and encourage them to look at their safety. It respects the important role of firearms and medication may play in the veterans' lives. And we want it to be consistent with their values and their priorities, not ours, not what we think is best. Even though we're giving them education, it's still their choice. All right. The reason why this is important is the research has showed that most suicidal crises are brief in time, and the decision from thought to action is less than 1 hour. Looking at the percentage of attempters, so 24% of attempters, they had the thought and they acted within 5 minutes. So that's very impulsive. But 48% less than 20 minutes. So we know in 20 minutes, half of the people who may have died by suicide, they had that thought to action just in a brief time of 20 minutes. And then 71%, almost 3/4 of the people had that thought within an hour. And so what we know is it's important to just put a little time and space in the midst of that. Interventions that can happen between that first 5 minutes to an hour can save lives. And the other thing it's important to note is with firearm injury, it's very lethal. When you're looking at all firearm injuries for the purpose of suicide, 85 to 90% are fatal. And I've actually met a veteran who worked with our team for a few years who shot himself in the face and survived, and really became an advocate, talking with other veterans about how he wished he hadn't pulled that trigger, and that he wants his story to be inspiration for others, that you don't have to make that choice. But what we know is that majority of the time that is a fatal suicide attempt, compared to 5% of all other methods combined. The lethality is very low. Well, not very low, but it's lower than handguns. And so we really need to talk about lethal means safety with our veterans. All right. So suicide is preventable. I haven't shared this. I usually share it in the beginning of the presentation, but the reason I got into this suicide prevention, this mission, is as a social worker, come from a big family, and we're a very supportive family. And I was working in this psych inpatient unit at the DC VA. And I was working with veterans that had substance abuse and mental health issues. I was screening for suicide, and it was something I was comfortable doing and competent in doing. But I lost my own cousin to suicide, and it was something that shook me because I realized that as a professional, I knew exactly what to do. But when you see something in someone that you care about, it is difficult. We knew that this cousin got depressed. We knew that he would drink when he got depressed, but we never imagined he would take his own life. And so I say suicide is preventable, but for those that have lost someone to suicide, it's difficult to hear that. But what we should be saying is it's preventable if we know the risk factors and the warning signs. And that's why trainings like this and other gatekeeper trainings are very, very important. So we're going to talk about some common myths and realities just to help make sure that people know what what to look for, but also some of the misinformation in the community that we have been battling, and it's been impactful with regards to stigma. And so we want to make sure that we debunk these myths. All right. So what about this one? And feel free to make any comments in the comment area if you know what your thoughts may be. But people who talk about suicide are just seeking attention. Is that a myth or a reality? I give a second for people to kind of make their choices or think about it. Okay. So what we know is that no matter how casually someone jokingly says something about suicide, it should never be ignored. And basically, what we know is that even when someone says something about suicide, they could be gauging how others will respond if they shared what they were really feeling. Someone who talks about suicide really is providing others with an opportunity to intervene before suicidal behaviors occur. And so it may be societal, belief that that's a seeking of attention, but what we know is that it's someone really asking for help. And so we want to debunk that myth. It's not someone seeking attention. They really are struggling and don't know how to ask for help. And that myth really is part of why people don't seek help, because they fear that people will assume that they're just doing it for attention. What about this one? The only one who can really help someone in a suicidal who is suicidal in a mental health is a mental health counselor or therapist. Let me read that again. The only one who can really help someone who is suicidal is a mental health counselor or therapist. What do you guys think about that one? Okay. The reality is special training is not required to safely raise the subject of suicide. Helping someone feel included and showing them genuine, heartfelt support can make a big difference during a challenging time. So do not feel like you need to have special training. Really, it's just a compassionate heart, understanding that someone is really at their lowest point, and just showing that genuine, heartfelt support can really make a difference. It can save their life. All right, so now we're going to jump into the S.A.V.E steps, the VA S.A.V.E gatekeeper training, and how you do that. So basically, the VA gatekeeper training is teaching communities how to help veterans at risk for suicide. VA S.A.V.E will help you act with care and compassion if you encounter a veteran who is in a suicidal crisis. It's an acronym, and it basically means you're going to look for the signs of suicidal thinking. You're going to recognize those if you see them. You're going to ask that most important question of all, and we'll talk about that, how to ask it. You want to validate the veteran's experience. They may be struggling with thoughts of suicide. and they may be having a difficult time really moving through that. You might not understand what their reasonings are. You might not relate to what is going on in their life, but you can validate that for them. Mr. Smith, I'm sorry to hear that you're going through that. It sounds like it's been a really difficult time, and I can't imagine what I would feel if I were going through what you're going through. And then the E, we say that E times 2 is to encourage treatment and expedite the veteran getting some help. So let's jump in and talk about these steps. All right, so the S is recognizing the warning signs. The warning signs of suicidal thinking would be someone that is hopeless, feeling like there's no way out of their situation. They may have anxiety, agitation, and I always circle sleeplessness because a lot of our veterans have a difficult time reaching out for support. Reporting that they're having suicidal thoughts or PTSD or depression, but a lot of times they will come in and talk about their inability to sleep. And so that really is for us that golden nugget that if they're coming in to talk about their sleep, we're going to ask questions about how is that lack of sleep affecting your mood? Have you had any thoughts of, self-harm? Because sometimes when we don't get enough sleep, it can really, really weigh heavy on our minds. And so we try to encourage them to open up about the other things they're experiencing. Feeling like they have no reason to live, having some rage or some anger, engaging in risky activities without thinking. We had a veteran come into our emergency room escorted by 2 of his battle buddies. They were out drinking in a parking lot, and this one particular veteran decided that he wanted to play Russian roulette with his weapon. And these 2 battle buddies said, "Hey, that's not funny. Are you okay? This is not cool. And we're going to take you to the hospital." And they basically escorted him to a facility. And he said he wasn't suicidal, but the behavior was very risky and it didn't have regard for his life. And so we were able to really support him and get him really connected to some treatment. Increased alcohol or drug use. So that really does increase the risk. So we want to ask about any substance use. And then withdrawing from family and friends. Maybe they're not connected to their family as they were before, and seeing less and less of their friends or even their veteran buddies. That can be an indication that someone may be struggling. All right. The presence of any of these following signs require immediate attention. Someone thinking about hurting or killing themselves, looking for ways to die. I always talk about to our veterans sharing handguns or weapons. If a buddy calls and said, "Hey, I'm going hunting. I'd like to know if I can borrow your gun," or something like that. I always educate our veterans to be mindful of suicide risk. Because we've had that happen before where someone, luckily they didn't die by suicide, but they borrowed a buddy's gun and they were actually sitting there contemplating suicide. And so we talk about that. If someone calls you up and asks, to borrow your gun or hold it for a minute, you want to think about why and ask those questions. Talking about death, dying, or suicide. And I always say writing and posting. We're in a new age of social media. And so we have to think about posting too, because people may write a note or, share their thoughts with their family in a letter, before making a choice to harm themselves. But also we've had people write a suicide letter on social media or maybe even live stream an attempt. And so we really have to think about social media. And luckily, there are some programs through Instagram and Facebook where if someone's at risk, now they have protocol to help the company identify who it is and then actually make sure that they can get some supports to that person. But we have to be mindful of that. And self-destructive or risk-taking behavior especially when it involves alcohol, drugs, or any weapons. So we want to be mindful of the thoughts that people have and the risk for suicide. That's the first step. Once we identify that, maybe someone's saying, hey, I'm in a bad place. I lost my mom 2 weeks ago and I'm having a terrible day, and I just broke up with my spouse, and my dog died. We know the risk is there. Now we have to ask the question. And it is as simple as, are you thinking about killing yourself? But there's so many different ways you can ask that question. Are you thinking about harming yourself? But you want to also make sure that you're not talking to someone who cuts for relief. Maybe they like to cut their arm to watch it bleed because it makes them feel some sense of relief. So when you say, are you thinking about harming yourself? That might be a yes for someone who's a cutter, but they're not thinking about suicide. So you want to just make sure that you're getting to the question that you want answered is, are you at risk for harming yourself or killing yourself because of your thoughts for suicide? And here are some do's and don'ts. So do ask the question if you've identified those warning signs or symptoms. You want to ask it in a way that is normal and flows in the conversation, and it's natural. I usually say something like, Mr. Smith, I'm so sorry that you're going through this. It sounds like, this is a really tough time for you. I will tell you, when I've worked with other veterans who've been through some difficult times similar, they thought about suicide. Is that something that you've thought about? And you just let them know that it's okay. People do have those thoughts when they're facing difficult times, and you allow them to express it to you without judgment. You don't want to ask as though you're looking for a no answer. Mr. Smith, you're not thinking about killing yourself, are you? I've even had a veteran tell me that he was asked by a provider when he was, approaching a crisis. He said, Mr. Smith, you're not thinking about doing anything stupid, are you? And it's important that we remember language has messages, and that when we say that, we understand that we're trying to discourage Mr. Smith, but what you just did was you made Mr. Smith feel even worse about the thoughts that he's having, that he can't control. And also, you don't want to wait until the veteran is walking out the door. It should never be the last question you ask when you're working with the veteran. You want to make sure that you give ample time, because if you ask Mr. Smith as he's walking out the door, he knows that you're not going to, you're both standing up, you're walking to the door. He knows that you're not going to have the appropriate time that it's going to take for him to really talk about what he's feeling. So most likely he's going to say, nope, I'm fine. And so it's important that the timing. And this is just a practice, and you will have access to these slides, but this is just a practice to, if we're in an in-person group, help people to really talk about what it feels like to ask that question. Sometimes it can be very scary, and so you want to, build your confidence around that. It's important that you understand that you can't go wrong by asking the question, because what I've heard from veterans is that questions, the thought has been on their mind, and when someone asks them about it, it really is a relief. It's an opportunity to share it. I had a veteran say to me, Miss Jones, you recognize something that my family hasn't even recognized. And I said, I can guarantee you they recognize it. They've just been afraid to ask you the question. And so don't be afraid to ask the question. All right, so the V, validating the veteran's experience. Talk openly about suicide. Be willing to listen and allow the veteran to express his or her feelings. The reality is sometimes the veteran can talk themselves out of it if you give them the opportunity just to share and you listen. Recognize that the situation is serious, though, and you don't want to pass judgment. And you can reassure the veteran that help is available and that they're not alone. Again, checking in practice, some validating statements, like you said, like we talked about a little bit earlier, in response to an invitation statement. The provider can say something like, everything is, the veteran may say, everything is so hard. I feel like a drag on my friends. Excuse me. Everything will be fine, really just validating for them that it's okay, they feel this way, and that help is available, and that they're not alone. So here are the expediting and encouraging and expediting treatment. It's important that we recognize that sometimes our veterans or someone will come to us with a suicidal secret. I've had a veteran say to me before, Miss Jones, I want to tell you something, but you have to promise me you're not going to take action. And I said, I can't do that. I do have a disclaimer, and whatever your disclaimers are in your area, or, in the work that you do, make sure that you're comfortable with saying it. And I said, Mr. Smith, I can't promise you that, because if it has anything to do with your safety or the safety of others, I'm obligated to intervene, because I don't want anything to happen to you. And that way they know that if you tell me anything about risk for suicide, I'm going to work with you. And unless you're acutely at risk, like if you're suicidal right this moment, we got to get some help. But if you're safe and you feel like we can work through this by developing a plan of action to keep you safe, then we can go that route. But it's important that they understand that you can't keep a secret. It's important that you, as a provider or a liaison to the veteran, that you can't leave them alone if they're thinking about suicide and they've expressed to you this urgency for that thought, like, I'm going to do it today. You want to make sure that you're with that veteran until you have some other supports, whether you're calling 911 and first responder will be meeting you where you are, or you're calling your medical team or escorting the veteran to an emergency room. It's important that you do stay close to them and ensure their safety while you have that one-on-one, interaction. And it's important to know the Veterans Crisis Line number. Now you can, that's the long number. It's still active. You can use it. But now you can dial 988. And I think of this and its importance is that just like 911, we now can call 988 for any mental health emergencies, just like we would for emergencies that are medical. And so it gives parity to basically our mental health issues, just the same as our physical ones. And it's even true, when I'm working with our veterans, I will ask questions like, oh, okay, how was your blood pressure today? Okay, what about your blood glucose? And then I'll say, oh, are you having any thoughts of suicide? Because I want them to understand it's just as important as their physical health. All right. So what to do if a veteran's expressing suicidal ideation during a phone call? You want to keep the caller on the line. You don't want to hang up or transfer. You want to remain calm. If you're calm, they'll be calm. But obtain identifying information. Say, hey, just in case we get connected, I certainly would love to know your information, because I want to call you back, because this is an important conversation. And you ask for their name, their phone number, and current location. Conference the call into the VCL, and you don't hang up. You can actually be on the phone with the responder, giving them information, and then as they're engaging with the veteran, you can then disconnect the call. Enlist your coworkers or any assistance via instant messaging or Teams if you have to do what we call a welfare check. If someone's saying, I have pills right here in my hand and I'm thinking about taking them, that's the moment you want to say, maybe you can IM your coworker and say, hey, I have someone who may be at risk. I may need you to do a welfare check. And that would mean identifying where that veteran is located, calling the non-police emergency number, or even the VCL can help with that. Sometimes if it's urgent, you want to call directly to the police so that they can get there as fast as they can. But it's important that you have a plan in your area. As supervisors, that's something you should think about when you're working with your team, especially if you have veterans that come in or call. There should be a plan of how you will handle a suicidal crisis. All right, so just remember, the S.A.V.E gives you everything you need to know about working with someone who may be at risk. You're going to identify the signs. They may be talking to you about what's going on, and all the while you're thinking, okay, is that a sign? Yes, that's a sign, yes. And so as you're as you're identifying these signs, it's important that you ask the question. You just say, hey, with all that's going on, it sounds like you may be at risk for some harm, self-harm. Are you having any thoughts of suicide? And once they really open up about that, validate their experience. And then you want to encourage and expedite them to get help. Now let's talk about some resources. We have some more slides just to really talk about the resources. So free and confidential support 24/7, 365 days is our Veterans Crisis Line. Our veterans can call, service members can call, family members can call, and friends. So if you're a loved one of a veteran that you think may be at risk and you want some information just to find out what you can do to support that loved one, you can call the Veterans Crisis Line by dialing the 988, pressing 1 to indicate that this is regarding a veteran. And you can talk to them about what supports may be available, what you should look for, how to connect with the suicide prevention team at the local VA, at where your loved one receives their care. So it's important that people know it doesn't just have to be the veteran. Someone who's concerned about that veteran can call also. They have chat, which you can chat online with someone if you're, having a difficult time and maybe not able to call or uncomfortable with calling. You can chat. And this works well for our younger veterans. And then they even have text where someone can text 838-255 and start to connect with someone to get resources and ask questions and so forth, really to help a veteran, whether that be themselves or a loved one. So it's important we know that these resources are always available for our veterans. This is just a little bit about our timeline. We created our programs, our suicide prevention programs in 2007, as well as the National Veterans Suicide Prevention Hotline, which was the name of the VCL, the Veterans Crisis Line, when it first came out. And it just gives you a timeline of what we've done, but I'm going to point out the most important information. 7.6 million calls, 910,000 chats, 306,000 texts, 1.4 million referrals for veterans to veterans VA suicide prevention coordinators and local teams so they can get connected to resources in their community. But most of all, 313,000 dispatches of emergency services. And potentially that's 313,000 lives that could have been saved. And so we're really proud of the work that we're doing. We're proud that we're leading the way in this country to really focus on suicide as a healthcare system and what we can do to help people who struggle in this way. Our new campaign for lethal means is keep it safe, keep it secure.net. And basically it is a webpage that the VA's teamed up with. It's part of, if I'm not mistaken, it's part of our MyRIC, our mental health research arm of the VA, but really talking about the importance of firearm and other lethal means safety. Nearly half of all veterans own a firearm, and most veteran firearm owners are dedicated to firearm safety. And so we really we want to make sure we're having conversations about firearm safety. So this is a website where you can get some more information. We have brochures. We're really making sure our providers know how to ask the question. And also our families know that they can reach out to us for free gun locks. Our VA medical center system has given out 7,000 gun locks this year alone. And so we really want to make sure if you have weapons at home, we want to make sure that you are okay with asking us for a gun lock and that you can get it for free. We've learned lessons, though. I will tell you that we had a veteran who was engaged in treatment in our system. He asked for a gun lock. He acknowledged having a gun at home. We offered a gun lock. He said, great. He said he was going to go home and secure that weapon. And we were like, yay, life saved. However, what we didn't know is that he had 29 guns and unfortunately died by suicide a couple of years after that, when we provided a gun lock. And so now we ask differently. I don't ask, do you have a gun at home? I ask, how many weapons do you have at home? And how many gun locks can we give you? And I've actually given a box of 30 to a veteran who said he had 30 at home. I didn't ask any questions. We just want to make sure that our veterans have them if they want to secure them and that they have no shame about how many they have. We will provide free ones for them if they need them. Also, this VA SAVE training, a 25-minute long version, is available online through Psych Armor Institute, which the VA has partnered with so that our community partners in the community that serve veterans that may not come to the VA at all, we wanted to make sure that they also knew the risk for suicide for our veteran population. And so this SAVE training is available and it's free. All right, so at this point, we're at the Q&A discussion, and I will turn it back over to our moderator.
Thank you so much, Ms. Jones, for that very informative presentation. That was wonderful. Now we're going to address questions in the Q&A box on the screen. In the Q&A box, I will read the questions out loud, and Ms. Jones will provide a response. I don't see a lot of questions. So let's start with the first question, and the only question that I see is from Marilyn Harris. And she asks, what do you say when you do not know what to say? What do you say when you do not know what to say?
You know, that's a great question. Sometimes you can even say that, you can say, I'm sorry to hear what you're going through. And I don't know what to say, but I am here for you. Sometimes it's okay to say we don't know what to say. People do understand that. And it's the most honest thing that you can say. But I also feel like just adding that you're not alone. I'm here for you. If there's anything that I can do, let me know. Because even though I don't know what to say, I'm here for you. And it's just a nice way to let someone know that I'm uncomfortable with this situation because I'm not familiar, but yet at the same time, I care about you and I want to be here and I can help in any way that I can. That's a great question.
Thank you. Thank you so much for that question, Ms. Harris. And that is the only question that we have in our Q&A summary here, Ms. Jones. And I would like to say to the audience, if you do have any questions for the presenter, Ms. Nikole Jones, please see her point of contact information on the screen now. She is the Suicide Prevention Coordinator for Perry Point VA Medical Center. Here's her phone number, her email address, and a website to the mental health suicide prevention website. So also you can feel free to reach out to our team for any additional information that you may have. We do have everyone's point of contact information that signed up into the webinar today, and we can get back to you. If you registered for this event, we will provide you with today's handout. Thank you again, Ms. Jones, for your presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. I do have one other question that came in. Ms. Jones from NAS. When do you know when to take them to the emergency room? Call 911 versus calling the crisis line. So they called 911 versus calling the crisis line.
Yeah, I would say the main question would be, are they thinking about doing something to themselves in that moment? Like, do they, the follow-up question, are you thinking about killing yourself? And then the next question would be, have you had any thoughts about how you would do that? And then if someone actually has thought through what they would do, that would be someone that has really thought about it and may have started making plans to pursue suicide. And so that would be the indication that they may need to talk with someone immediately. If they're actually planning it and have access to lethal means.
Okay,
So maybe
thank
they'll.
you. I'm sorry.
Mhm.
So thank you, Nels, for that question. That's all the time that we have today. For our questions, we do have your point of contact information. For the questions that we didn't get around today, we will get that question to Ms. Jones for her to provide a response back to you as soon as she can. This ends today's webinar. Again, please subscribe to our website and Facebook for future webinars and information. This adjourns today's webinar. Thank you for joining us today, and goodbye.